And I want to kind of dig into a topic that's come up several times over the course of this hearing, which is this area of prior authorization. Now, generally, I like to take a step back so that folks at home can kind of understand what it is exactly that we're talking about here. I think most people hear the term prior authorization, and understandably, our eyes start glazing over in this bureaucratic language. But in the way that this affects our lives is that if someone is diagnosed with a condition, an illness, a disease, they require medication treatment of some kind, their doctor may recommend it to them, and that doctor has to very often, depending on their insurance, ask their insurance for permission so that their insurance can say, we will cover this treatment or we will not cover this treatment. And that is the process known as prior authorization. Is that in a fair description of it, Dr. Mello?
It is, and I would just add that it also applies to procedures and surgeries.
Yes. And prior authorization oftentimes can be a really big headache and pain point for patients and doctors, and especially if you have interacted with a for-profit health insurance company, although all sorts of health insurance companies use prior authorization. You've likely dealt with this, and there have been famously, I think, videos that have circulated on social media of doctors trying to haggle with an insurance company, of everyday people trying to navigate their chemotherapy or any other sort of condition with the prior authorization system. And if you have a Medicare Advantage plan, which is the for-profit version of Medicare, you've definitely dealt with prior authorization. In fact, in 2023, Medicare Advantage for-profit health insurers filed over 100 times more prior authorization requests than traditional Medicare. And Medicare Advantage plans also deny care to patients at significantly higher rates than normal. Medicare Advantage plans deny as much as 16 times the normal rate. Does this sound consistent with some of what you've seen, Dr. Mello?
Yes, I believe that's what numerous reports have indicated.
And this is all to restrict patient care because we have a profit margin to maintain. And many of those for-profit insurers use unregulated and unsupervised AI models to review prior authorization requests. And I think it's very important that people understand that this is happening, that AI is being rolled out in the industry so that when a doctor who has gone through 4 years of medical school in addition to their additional training say that a patient needs something and they submit a prior authorization request, many times an AI model may deny them that care to a human being who has gone through extensive medical training. Now, Mr. Toy, you've said earlier in this hearing that you are the CEO of Clover Health, but you've said in this hearing that Clover Health does not use AI in your company to implement prior authorizations, correct?
Correct.
But you have seen this happen in your industry.
That is correct.
And you disagree with this usage. Why?
I disagree with it because it should always be a clinician who's making this decision. So I myself, as I said, I'm also a patient. Mm-hmm. I have had my own scans be denied through prior authorization. Mm-hmm. And I fortunately have the sophistication to navigate my own appeal, as you said, to get there. But that is not a reasonable thing for it to happen.
And for a person that is diagnosed with a condition in which time is of the essence, and an AI model has denied a trained clinician the ability to provide them care, this could potentially threaten a person's life, correct?
Absolutely. Timely care is critical in many cases.
And so we are seeing certain healthcare companies, and on top of that, the Trump administration has planned to launch a new program to expand the use of AI in prior authorizations known as WISER beyond Medicare Advantage and into regular Medicare recipients. Mr. Toy, it is not your company's plans to participate in the WISER program, correct?
That's correct. We are not participating,
And you have no plans to?
and we have no plans to.
Thank you very much, and I yield back my time.